The capacity development team in Latin America, based at the Panama Regional Center for UNDP, is looking at improving public institutions generally in all different kinds of areas of work. And one of our areas of work is making aid more effective. Official development assistance, while not high in Latin America, is an important input to development results in the region. So we are working with different country offices and country teams in the UN and the UNDP specifically to improve the management and coordination of official development assistance. Not long ago, we had a request from the UN country team in Belize on wanting to improve the effectiveness of aid in the health sector. Now, we have worked on the health sector in other areas of the world, and we thought this was a very interesting experience to look into in supporting the country team. We therefore worked directly with the country team and their representative in PAHO, the Pan American Health Organization based in Belize, to see how we could support them in this process. And now I would like you to listen to some of the reflections made by the representative of PAHO in Belize on how this process evolved and what results it gave us.
Well, the theme of this meeting that was held on the 17th of May was strengthening aid effectiveness in Belize using health as a tracer sector. And we have been concerned for some time in the Pan American Health Organization, World Health Organization, about the amount of assistance and cooperation and aid that countries such as Belize get in health, and the fact that sometimes they're not exactly aligned with the national priorities and plans and programs and policies. So it was our intention to work with the Ministry of Health to try and see how we could improve this aid effectiveness, aid coordination and management. And in a meeting of the UN country team, I mentioned it, and the team was extremely happy to collaborate, and we all have pitched in to address this in a broader sense, though we still think we will use health as a tracer sector. Of course, the Paris Declaration and the Accra Agenda for Action are very important frameworks in this action, and we collaborated very well with Mr. Gert Danielson, the aid effectiveness specialist and South-South Cooperation advisor at the UNDP office, regional office in Panama. So in that collaboration with Gert, with the UN country team, and with critical ministries in among our national counterparts, we had an excellent meeting. We made recommendations that one particular ministry should be the focal point for aid effectiveness strengthening. And of course, that is a decision to be taken by our national counterparts. We also suggested that there be a capacity assessment and subsequent capacity development of national counterparts, perhaps starting with that focal point ministry and the Ministry of Health. And also that we should try our best to establish an aid management system so that we could make informed decisions and evidence-based decisions in this matter. And finally, a recommendation from that meeting was that the donor group in Belize get its own act together and try to harmonize its actions better. The meeting had about over 50 participants, and these were drawn from embassies, from sector ministries, from civil society organizations. So we thought we had a very good representation, and we're looking forward to further collaboration with the counterparts and the UNCT in getting this strengthened in Belize.